Bile duct cancer is a cancer of the cells that are lining the biliary tree, which is the tubing that drains the liver and the gallbladder into the intestine. And one of the challenges of this particular cancer is that it's often not picked up or diagnosed until the patient becomes symptomatic. Generally, the symptoms are related to the fact that the bile can't drain properly because the cancer causes a blockage in the bile duct. And that leads to a buildup of bile in the upstream ductal system, which can cause pain. It can be a nidus for infection, and it can also cause the bile to leak into the bloodstream and cause a yellow tinge to the skin or to the eyeballs. And that's often when this type of cancer is picked up. So once the patient becomes symptomatic, then investigations are done to try to figure out what's causing the symptoms. And if in the case of bile duct cancer, it's usually diagnosed by actually going into the bile duct, relieving the obstruction, which helps relieve some of the yellow skin and the pain or the infection that can be caused by the blockage. But also it allows the endoscopist to take some biopsies or samples, which can then be sent to be looked at under the microscope, and the cancer cells can be identified and diagnosed in that situation. And right now, really the only cure for this type of cancer is to have it surgically removed. And it can be very important to decide which patients are going to benefit from surgical removal of the cancer versus which patients are going to benefit more from an approach where we manage the cancer or palliate it, as we call it, using medications such as chemotherapy or radiation or other ablation techniques that can also be done endoscopically. And that's really the critical decision that's made once we diagnose this. My team and I just recently published a study that really tries to help optimize the surgical plan for patients with bile duct cancer. And the basis for this study is that this new technology allows us to insert a camera up into the bile duct so we can know exactly what part of the duct is involved with tumor and what part is not. In other words, we're mapping the bile duct for the surgeons ahead of time so that we can make sure that they're getting the exact right operation that would be best suited for them. So the study involved actually 9 different academic centers across an international group of hospitals. It included just about 120 patients. And what we did is we looked at patients with bile duct cancer who underwent evaluation with this new imaging modality where the bile duct was evaluated. And we looked to see if that changed the surgical plan for those patients. And what we found was that in about 30% of the patients that had this intervention prior to the surgery, it changed the management of their cancer, meaning that some patients had less extensive surgery than was initially planned because we found that the tumor was involving less of the bile duct than was initially thought based on imaging modalities with MRI alone. And some patients had a more extensive surgery because we found more of the bile duct was involved. And what's interesting is we actually found some patients that were initially going to be planned for surgery, but when we did this procedure, we found that so much of the biliary system was involved that they actually wouldn't benefit from a surgery at all. It would just put them through a big operation without a benefit of offering them a cure, and so we avoided an unnecessary surgery in those patients. I think this study perfectly illustrates the overall goal of advanced endoscopy and what makes this field so exciting right now, in that we're really trying to offer patients the best efficacious therapy in the most minimally invasive fashion. So for more information or to schedule an appointment to meet with me or one of my advanced endoscopy teammates, the number to call is 732-235-8970.
RWJBarnabas Health. Let's be healthy together.